Hello, and welcome to the Gamut of Performance Podcast, Episode 4. Today, I have the pleasure of talking with Dr. Justin Dean. Dr. Dean is a chiropractor in the Los Angeles area and has worked very closely with the powerlifting community as well as the long-distance running community. Today, Dr. Dean and I get into the integrated team approach and how working with a group of like-minded professionals can really elevate your practice and the level of your clientele. This guy is one of the smartest people I know, and I'm really excited to share this with you today. So without further ado, here's Dr. Justin Dean. Dr. Justin Dean, thanks for being on with us today. I really appreciate your time. I've been looking forward to this call since we basically, we've been talking about this for a while. We met a couple years back. Little did I know that we'd be here talking on this podcast, right? So thanks for being on with us. Why don't you just tell us a little bit about your background and kind of what you do?
All right. My name is Dr. Justin Dean. I am formally trained as a chiropractor, and I have worked with primarily the athletic population, and that's been my focus in practice thus far. In college, I ran an NAIA school. I was a distance runner. Okay. And from that sparked my interest in chiropractic because we had a team chiropractor. Mm-hmm. And then from there, at Adams Chiropractic School, I started to realize that it wasn't fully the education that I wanted to learn, such as in the strength conditioning principles and physical therapy. Mm-hmm. So I started traveling and very fanatically started learning various seminars, different treatment approaches, and combine that with chiropractic.
Okay. Awesome. And I know you do a lot with strength and conditioning coaches, and you kind of touched on it a little bit, but how did you really get involved, like working with strength and conditioning, and how has that shaped your view as a chiropractor?
Well, from a historical perspective, I started a club at the chiropractic school because I saw a huge hole in the curriculum, and it was the UWS chapter, University of Western States, for an international organization known as Rehab to Performance, which the whole point was to combine the continuum from rehab, which could be anything in the pain model, from pain to performance. And naturally, if you're talking about that continuum, that involves medical professionals such as myself and strength professionals such as yourself, and everything in between. So our jobs somewhat overlap, but we need to know when to pass the baton and know that, well, you're beyond my skill set now, and now it's time to get to the next level, which is performance. So that's how I primarily have worked with strength coaches in the past. In many aspects of it. I don't necessarily do the programming myself, but I do everything up to just making sure that they're ready to handle any programming that the coach will.
No, that's a great point of passing the baton, right? Because a lot of times you see in strength and conditioning, a lot of us want to try to do everything ourselves, right? So we want to do the rehab, we want to do the, things that we're not necessarily qualified to do. And sometimes, that's a situation where you're in a super small school and you have no resources. But a lot of times it's just like, you got to get hands off, So that's a really good point.
Sometimes I do the strength training and programming with like patients that don't want to go see a personal trainer, they just want to see me. Yeah. So there are instances when I do everything myself. But if we're talking like a high-end athlete, I don't pretend to be an expert at strength and conditioning.
Yeah, and no, that's how we can work together, right? Because in your setting, right, if someone's too intimidated, right, to seek out, say, a personal trainer or a strength coach or something like that, right? Like communication just like this, right? We can help each other learn and we can help each other get better in our own practice. So I'm all about that. So moving on to the next question. So you've done a lot of work with Chris Duffin, and so you've been on the Kabuki Strength chat. So kind of tell us how'd you guys get in contact? How'd you end up working together? And some of the things you guys have worked on.
Well, it kind of started out, the easiest way to answer that question is proximity. I lived in Portland, Oregon for 5 years before we went to and Duffin also trains and works in Portland, Oregon. And he had been working with my mentor, Philip Snell, for several years. And once I started working with Philip Snell, I also started working with Chris and all the athletes at Kabuki Strength. And over the years, just built a relationship of trust. And basically treating and working with him and the athletes, they know what I do, and they know what I know and what I don't. So they've added me to their medical provider list / advisory board ish to work on that continuum again, the rehab aspect of powerlifting.
Yeah. No, that's really cool. And it gives you a really good, view into that world, right? So that's super helpful.
Definitely for me, especially since I was a marathon runner, going into the now thinking of 900 pounds on a deadlift. It's a completely different way of thinking about movement and strain on the body. So it was great. It pushed me outside of my comfort zone, and because of that, I'm very thankful.
Yeah. No, that's cool for like myself, right? A lot of strength and conditioning. Like, there's a lot of people that are involved in powerlifting and stuff like that, but there are also a lot of people that aren't involved, right? And kind of like we were talking about before, right? Like, Chris Duffin's gonna know how to get someone a lot stronger, necessarily, than myself, and just realizing expertise of each individual. So that's pretty cool that you guys get to work together.
Yeah, definitely. And from that relationship, I got a lot of personal one-on-one time with him, how to coach and cues and everything that he uses for the three main lifts, such as bench press, squat, and deadlift. And from that, I use that clinically to figure out why somebody may say, hey, have elbow pain with the bench press, because now I know what ideal form looks like relatively. It makes me better at diagnosing what things going on and how to correct it. So now that I can structure my treatment and rehabilitation towards getting them to optimal form and technique in said lift.
Yeah, no, that's great. That's super helpful. Taking a step back, right? So we met in Portland. One of the things we met over was DNS, right? So I know you have a background in DNS. So can you kind of unpack that for those of us who aren't familiar with it?
All right. So DNS stands for Dynamic Neuromuscular Stabilization. I think it's been popular in the United States since about 2012, 2013. I took my first course in 2012. And in sense, man, when I first took DNS in 2012, nobody had even heard of it.
Yeah.
But I was just kind of a super nerd, so I was like I was always looking for like what I need to learn next, and DNS was always there. So when I took the course, like it was like nobody had ever heard of it.
Yeah.
And then now it's like Nike. It's like everywhere, like the standard for a lot of rehabilitation approaches.
Yeah.
So I've taken probably I don't know. I've taken DNS Sport 1 3 times, DNS Sport 2 2 times.
Okay.
I've taken I've taken a bunch of sports. So I've taken like probably 12 seminars. So it's quite a bit of time in actual course. And then I also am friends with a lot of instructors. And now I work with Yoav Nagar, who's been doing DNS for 20 years.
Yeah.
He was one of the first Americans trained in it.
Wow. Okay.
So it's quite a bit of exposure, and I'm very fortunate to be able to see how it's used in its pure form and be able to modify and wing it.
Yeah. And I went to a couple of those courses, right? And it's a lot of information. It's super dense. And so can you kind of, let's say, break this down a little bit? So how do you use it in your practice?
Well, we should talk about the premises based on it. I'm not an expert by any means, but it's based on developmental kinesiology.
Yeah.
The nerve develops in a predictable sequence of events, and by studying kids with cerebral palsy that have developmental delays, they can help kids via reflex points and certain movements help the nervous system catch up, essentially.
Yeah. Okay.
So that mentality has been applied to adults, but that's not the way that I think about it or use it. Okay? The way I think about it and use it is very simple. We've got to create a solid cylinder. And when I say the cylinder, I mean basically what most people refer to as the core. In most athletic positions, in most sports, and there's always exceptions, we want the diaphragm, to depress as we breathe in, and the pelvic floor at the bottom and the pelvis to resist it. And we want them to be relatively parallel. So it creates like a piston-like action, and then the internal, external, obliques, transverse abdominis, everything expands outwardly, and we have 360 degrees of stability. And a lot of times when this is off, people tend to like hike that, like for example, on a back squat, they tend to arch their back real hard, which would take that diaphragm and pelvic floor and make them not parallel, but make it kind of an open scissor position that we call it. And then we lose power and potentially increase our risk of injury, in theory at least. And so I primarily teach people to become aware of those parallel lines and how it increases their strength. So I don't necessarily use it to the exact degree that we were taught in the course when you took it. I use principles from it. So if you're in a back squat, I'm gonna help you get more of what's considered ideal neutral alignment of the spine. And that's more of a DNS concept, and I'm going to use the DNS bracing strategies, which Duffin also uses. And from working with Duffin since 2012, he's reported back to Philip and I that when he started using these DNS bracing strategies, the numbers, their numbers in the gym of what they were lifting, consistently across the board, all their athletes began to improve.
Wow. Yeah.
So that's anecdotal, but
no,
that's one gym's feedback on that. So I will get people on their back and get them into that 3.5-month position, and just teach them how to control that thoracolumbar junction, which clinically is crazy important because a lot of pain syndromes originate from there, and you can really address quite a bit of problems, especially knee problems, by just teaching them how to control their diaphragm and thoracolumbar junction.
Yeah, no, that's super good because in the college setting, right, we got kids coming in with knee problems, right? So you got, I don't even know, like freshmen, everyone's got something going on with their knees, right? Especially in basketball. So that's super important. That's one of the reasons one of the biggest things that I drew from it was, oh man, this is how we can reset, right? And kind of shifting gears a little bit, but staying on that same thing, right? So I know you haven't done a ton of work with PRI, but let's just kind of debate and kind of compare and contrast those two, right? So PRI, so I know a little bit about it. Hopefully I explained this right, or I'm going to get a lot of hate comments out here. But essentially, you're working around three bones, right? The sphenoid, the sternum, and the sacrum, right? And you're trying to restore reciprocal motion through breathing. So in that sense, it's quite similar. I think the biggest difference that I saw was the difference from the developmental positions. And I don't know, you haven't done too much on PRI, but what is your extent of the knowledge on it?
I've read quite a bit. I've watched some of their videos that they have, and I've talked to many instructors. And from my general understanding is that we just have an asymmetry in the body. Like the liver's on the right side, and it's heavy, big, and it's gonna make that. I have a tendency to have like more of a rib flare on that side.
Yeah.
The right ilium tends to be an out flare, and the left ilium tends to be an in flare. So the whole idea is that the body is anatomically naturally asymmetrical. Yeah. And relatively, and I may be butchering this, but I think PRI is a way to somewhat level out those asymmetries a bit, but the body is naturally asymmetrical.
Yeah, and so that's that. I think it's left AIC, right BC, something like that. Somebody can correct me, but the one thing that I found was so important was that they both center around breathing, right? So that just kind of tells you how important breathing really is. And I mean, you do it X amount of times a day, right? So that's the most frequent thing. So if you're breathing incorrectly, like, you can just imagine the implications that has on the rest of your patterning. So
sure. If you want to talk about from recovery perspective, like, I mean, from a clinical perspective, I see a lot of people that tend to be more of a chest breather, and they like breathe up high into their neck, and they tend to have a lot of neck pain and headaches, and that's going to put a lot of more oxidative stress on the system. So if you have a student athlete in your instance that's highly stressed out from a test, and they're breathing up into their up into their neck,
Mm-hmm.
and then their pitcher and their shoulder hurts.
Yeah.
Like, you not only are you not giving that shoulder a proper stability that it needs during a pitch, but you also have a system that is more susceptible to injury because it's stressed out and it's not getting not getting enough oxygen.
Yeah. No, that's
so it all works together.
Yeah, no, that's a good way to look at it, right? Systemic versus segmented. So, kind of going on that topic of working with athletes, right? So, obviously, you've had a background in distance running, and you've worked with a lot of distance runners. Can you elaborate a little bit on your experiences with that population? And do you have any suggestions that you've seen from working with them?
Yeah. So, interesting thing, a little background story on myself is I was a very, very big distance runner.
Okay.
I was about a 228 marathoner
Yeah.
at 170 pounds.
Yeah, that's not your typical runner.
So that's a very, very far outside the norm.
Yeah.
Of a semi-elite distance runner.
Yeah,
so I was never allowed to be in the weight room.
Oh, okay.
My coach would never allow it because the second that I started lifting any weights, even just body weight stuff, or like I would just bulk up.
Yeah.
And
I envy you.
well, I would bulk up and it would slow me down.
Okay.
So for the sport that I was doing, there's a lot of arguments for. And I think distance runners should strength train. And now, knowing what I know now, I'd probably do it in a way where I wouldn't get super huge.
Yeah.
But that was the mentality that I had in college, right? Way too bad.
Definitely. Yeah.
But now, the biggest thing and I've done a lot of coaching, assistant coaching in high schools, and I've worked with colleges, and then last year I worked with the Chinese national team members.
Okay. Wow. Yeah.
And the universal thing that I see is the general lack of single leg stability, strength.
Okay.
In distance running athletes.
Yeah.
Like, I mean, a distance runner that can run, like the defending national champ in China, who won nationals again after I worked. I mean, I don't know if it was me. I'm not saying it was me, but
yeah.
When we started working together, she couldn't stand out of a chair on one leg.
Wow. Okay.
She didn't have the stability to act. Yeah. She didn't have strength, single leg strength to actually get out of a chair.
That's
she
big.
could run a 150, 800 meters.
Yeah.
Now, whether or not single leg strength is associated with speed, well, that's a completely separate argument. But you would think that we would need a baseline level of strength.
Yeah.
In single leg stability, in an athlete that spends one leg on the ground at a time.
Yeah. No, that's big because, I mean, if we draw that across other populations, right? Like, most athletes, you're going to be on one leg for a lot of the time, right? Because any sport, for the most part, you're running in all sports. And so, in running, you're going to be on one leg. So that's a good point to touch on.
Yeah, totally. So, and then it goes back to that thoracolumbar junction. A lot of distance runners tend to, when they get tired, they start arching their back, and then their pelvis kind of tips anteriorly, and their ground reaction forces, how hard they're hitting the ground, increases. So now we have those facet joints in the thoracolumbar junction just taking a beating from a tired athlete. And then the cutaneous nerves that come off of that segment of the spine starts to produce a lot of hip symptoms, knee symptoms, even all the way down to plantar fasciitis.
Okay.
So really most of the time that I spend with distance runners is working on that canister that we discussed previously.
Yeah.
And what was I going to say? Working on the canister and then, the single leg strength.
Okay. No, that's a good point as well because plantar fasciitis, right? If I'm talking about basketball, I work with basketball, so that's one of the reasons I'm bringing it up. But you see a lot of plantar fasciitis, right, from that continual pounding. But another thing you see is they're in that arch position, right? So they're getting their facets jammed up. So a lot of people, I don't really think, look to the back, right? We're trying to treat the symptoms locally, and so you see a lot of like rolling on the foot, which can help and which is not bad. But if we're not treating the cause, right, then what are we really doing? So that's a good point.
Well, the interesting thing about basketball players that I've noticed with, and I did work with quite a bit over in China, is that if you think about that and plantar fasciitis, their feet are so bunched up in shoes all the time that are pretty tight. most basketball players, you correct wrong, like tight shoes because they like that control.
Yeah.
Most of them, once you get them out of shoes, they can't lift their big toe.
Yeah.
So if you can't lift your big toe, you're not going to put tension from the big toe, the windlass mechanism, into the arch, into the calf, into the hamstring, into the glute. So your plantar fascia is going to take more of a beating.
I didn't even think about that. That's good.
You got to look at the back, but you look at locally. And everything matters.
Yeah.
To some.
That's a great point. Because if you're an athlete, right, especially like coming into college, right, you're not thinking about how all that stuff is connected, right? You're thinking like, if I work this muscle, I'm gonna get X result, right? And especially like most athletes, like vertical jump, right? That's one of the hot topics. Everyone wants to hire vertical jump, right? So they're not thinking about that canister, right, if you will, of like how that can affect their strength and how they display their strength and power. So moving on, so we kind of touched on some back pain, right? Back pain's huge in athletics, right? Especially with college athletes, a lot of the ones I work with, right? So for example, like field hockey, ton of back stuff going on, and that's largely in part due to their mechanism of their sport, right? They're in hunched over position, so they're in flexion and rotation, which, as we know, is not the greatest position for the discs to be in.
Sure.
But how can we help with that as coaches and practitioners to kind of offset some of that effect?
Well, I think step one is to understand injury biomechanics. Lumbar flexion, as many people on social media have pointed out, isn't necessarily the devil. Not everyone that gets into those positions of forward flexion and rotation are going to have issues. And arguably, you could say that people end up being good at field hockey or genetically have more robust discs that don't push on the nerve root. So when you get into sport-specific thing, you're probably going to think that they have a certain genetic composition that allows them to play that over time.
Okay.
So that's just something that I think is kind of important to consider.
Yeah.
But but what I was originally going back to was the injury pathobiomechanics. We know that flexion and rotation is injurious, so we probably should, off the field, not be doing a ton more of exercises into flexion or rotation. So there's relatively little benefit to stretching, especially statically, into lumbar flexion. That's just reproducing more of the same. You wouldn't tell somebody that sits at a computer typing all day to sit at a computer more so that you get used to it.
Yeah. That's just logic, right? So
you got to do a little. So you obviously want to strengthen the posterior chain deadlifts and make sure that they maintain somewhat of a neutral spinal flexion. But also you got to know which tissues are going to be the ones that are going to get sensitive first, and that's generally neurology. So implementing a simple neurodynamics warm up and cool down. As part of the preventative measures for that sport, could be just some neuroglides or some static openers from Michael Shacklock's material. Can do wonders in keeping that system less sensitive for longer.
Yeah, that's a good point. No, that's a level that I think a lot of people don't get to, right? The neurological level, right? Because we're dealing with muscle so much that a lot of that kind of deeper stuff gets overlooked. So.
And from a clinical perspective, this is going to probably sound a little bit crazy compared to mainstream, but the amount of pain syndromes that I see that are, let's take hamstring for example. I have seen 2 or 3 actual hamstring tears. Okay. In 5 years of working with professional sports. Wow. Okay. Like MRI confirmed bruising. Most of the time, it's a sciatic nerve, or sort of motor control issue that's creating the problem. So, when we shift our mindset, if you really do a very thorough, intense examination, you don't find any findings for a tear of a hamstring, but you find your slump test always recreates the hamstring pain.
Yeah.
And then you start looking at cutaneous nerves and big nerves and then motor control. And generally that hamstring pain, that strain that they come in, I say, I tore my hamstring.
Yeah.
And they're wondering how they're playing again in 6 days.
Yeah.
Because we treated the actual problem.
Uh-huh.
And then the coaches call you and be like, how is this guy playing when he has a hamstring tear?
Yeah.
It starts to be like, well, it's not a hamstring tear.
Yeah.
Or at least not a very significant one.
Okay. So what can we do on our level? Is that something that you that we need to refer out to someone like you, or is there something that we can do to say make that any better on our end?
Well, I mean, you could generally, if there's pain on board, a strength coach should at least refer out to get an evaluation by somebody like me. But the reality of the situation is that's not always the case.
Yeah.
There's not always somebody in your area that has because if you're just doing what you learned in school, whether you're a physical therapist or a chiropractor, you're not going to be equipped to deal with what I just mentioned.
Yeah.
So as a strength coach, what can you do? You can basically just do some slight neural glides and see if it makes it better. And all that really quite is lay on your back, put your hands behind your knee, straighten your leg until you feel tension, no pain, go and then back off of that, and then go back and forth 10 or 15 times, and then redo whatever was painful, whether it's walking or touching your toes. And if it gets better by 30% or more, just have to do more of that, which honestly goes back to that feel hockey question of how do we prevent this stuff? Well, that same thing that I just said would make that hamstring potentially better is the same thing that athletes can do before and after exercise, especially ones that are like field hockey players, as a preventative measure to hopefully decrease the amount of pain that they have during the season. Yeah.
No, I like that. And that's something that, like, personally, I will have to start looking into more implementing because, as I said earlier, like, a lot of us don't necessarily go that deep, right? And I think I'm guilty of it as well. There's a lot more that I could be doing on that neuromuscular level.
Sure.
No,
but to do your due diligence, you should. You should still be working in cahoots with a rehab professional. It could be the ATC at the school. Just so you're not taking on that responsibility yourself.
No, for sure. Yeah, and that just
a team approach. Like I wouldn't. Like if an athlete came to me and said, "I want to pitch fast." Well, these are some things that I can do to make sure that you have the range of motion, the motor control necessary to get there. But as far as programming, we need to be working with your coach.
Definitely. And that's kind of what you said, right? That get back to the idea of like working on a team, right? So not necessarily just strength coach and athletic trainer, right? But having other people that you can refer out to that do know some of this stuff. And so that's been one of the problems that I feel like I've ran into. No disrespect to anyone in this area, but there's not necessarily people like you, right? That are even aware of certain things, right? So that's where the difficulty lies in certain areas, right? Just because I'm in a very rural area.
Well, but the way that the information spreads is that you have the first responders, people like me that spend $100,000 in courses and learn everything that they possibly can. And then we put stuff on social media and then people learn for free. So it's just a matter of time before all this stuff becomes very, very mainstream. I think, and it's probably going to take another 3 or 4 years. I've noticed a huge, like just in the last 2 years, the amount of like knowledge that students in chiropractic school that are getting free that I paid buku amounts of money for. So it's not going to be very much longer before this newer information is starting to spread, because that's the information era that we live in.
Yeah, it's crazy how fast things disseminate, That's why I love like being able to communicate like this, right? We're just raising the profession in both our fields. So
for sure. And that's my goal of always teaching and is always just make it a better environment for either a pitcher or an athlete to get back to be what they love, because I only have 4 walls and I can only help people right in front of me, patients and athletes. But if I teach what I know to other people and other people do the same for me, we all get better, and the people that benefit are the athletes.
No, exactly. I 100% agree. And I think that's a good segue, right? So tell me about this like soft tissue technique that you've been working on with Dr. Snell.
Oh, okay. So about let's see, about 3 years ago, Dr. Philip Snell and I we started to experiment. That goes back to this whole neurologic pain syndromes, and we were learning from various sources, and we in practice had been figuring out that nerve pain, if you target the nerves first, you can make quite a reduction in symptoms. And a lot of things that we thought were musculoskeletal, like such as tendons and fascia and muscles, just weren't as prevalent as we learned in school.
Okay.
Pretty much in school, you learn everything as a tendon or a ligament or a muscle.
Yeah, that's the textbook understanding, right?
Yeah, that's what we're taught. That unless you have back pain with radicular symptoms and loss of DTR and numbness, tingling, or weakness, it's probably not a nerve from what we were learning in school.
Yeah.
So as soon as we started treating everything like a nerve, like we learned from our mentors, David Butler and Nike Shacklock specifically, we started thinking, well, what about the nerves in the skin? Because these nerves live in the skin. And there's a guy named Robert Main, who was a physiatrist, I believe, in Europe.
Okay.
He actually would inject the thoracolumbar junction and take away a lot of people's low back pain. And the proposed mechanism was the cluneal nerves that exit the TL and supply the skin over the low back.
Okay.
So that kind of took away some of the low back sprain strain diagnosis thoughts.
Yeah.
We started experimenting with, well, how would you create mobility in nerves in the skin? We know that nerves don't like to be compressed. The textbook example of that is a lumbar disc pushing on a nerve root, and you have pain all the way down your leg, known as sciatica. So massaging and pushing didn't really make that much sense because that's just replicating the mechanism of injury.
Exactly, yeah.
So we decided, well, what if you pull on the skin? I mean, skin rolling's been around for thousands of years, so that's nothing new. So, but what if you pull on the skin? So you have tension coming from above, and then you move. So there's basically tension going from below in a different vector, and now you're creating movement and flow at the nerve, at its interface in the skin. Okay. So we started experimenting with that. Basically, pull on the skin in very key areas where the nerves are known to be very superficial. We pull and move, and for example, if you have pain in your knee with squatting, you just grab on the saphenous nerve on the inside of the knee, right where they would inject it to kill pain, and squat again. And a lot of times you notice, like, wow, they no longer have pain in their knee with squatting.
Wow. Okay.
And so it was a very, very quick way to add into your assessment and diagnosis process. Okay. To start to differentiate tissues. Which tissues were causing the pain, and now you're becoming more accurate in your diagnosis. If you think of it like an onion, if the center of the onion is a joint, the joint capsule and that sort of thing, and then you work your way out with muscles, ligaments, tendons, fascia, skin, nobody ever talks about the skin. Yet it's the first layer of the onion that you encounter when you're dealing with manual therapy, and it's the layer of the onion that is exposed to the world and that sort of thing, especially in like combat sport injuries. Like if you're getting hit in the face or like you're getting hit from behind in football, those nerves in the skin are taking a compressive force, which is the mechanism of injury. So it might make some sense to try to theoretically decompress the area to treat the top layer of the onion, which oftentimes is ignored in physical medicine.
No, that's crazy valuable. Where can people find out more about this and like learn more about this?
Well, we kind of started it off as a big joke, so we gave it a funny name because that's kind of our personality. Okay. So we called it Yank Away Pain. Okay. You can find out way more about it at yankawaypain.com. Okay. We're currently in a rebranding process. We're calling it dermal traction method.
Okay, sounds a little bit better. Yeah.
Yeah, because it was starting to it wasn't growing outside of our circle of influence.
Okay.
Because people just thought it was a gimmick.
Yeah.
Which is fine because it was fun while it lasted. We didn't think that it was something that would catch on, right?
Yeah.
We thought that this was just us doing some sort of placebo thing.
Yeah.
That made sense, but we didn't know how people would really how they would respond to it.
Yeah.
So now that we've had a good response, and I mean, there's several sports teams out there using it now.
Yeah.
We're in the process of rebranding. So it's dermal traction method,
Okay.
but if you want, we have the entire body mapped out from head to toe, where all the cutaneous nerves live in the skin, where you can treat them.
Okay.
At yankaawaypain.com, or you can look at us on Facebook.
Okay. So is this some average Joe can use on themselves, or do you need a deeper understanding?
If you can pull on a skin, you can do this treatment to yourself. This is an average, totally. This is something that you could totally do yourself. I mean, people are shoving. I've seen some stupid shit out there where people are shoving lacrosse balls into their space here to relieve the scalene.
Yeah.
So if you can watch that kind of stuff on YouTube and do it to yourself, you can certainly pull skin.
Yeah, fair enough. And this is a little bit off topic, but it kind of brought a thought up, right? So, are you familiar with RPR at all?
RPR? No, I'm not.
So it stands for Reflexive Performance Reset, and it sounds a little bit similar, except this isn't traction. It would be more on, I mean, it's kind of like what you said about pushing on points, right? So you would hit certain points throughout the body, and throughout those points, it would give like a neural release. And so I wasn't sure if some of the points kind of coincided, so I'll have to do some research on that, but it sounds super interesting.
Probably. I mean, if you look at a lot of manual therapy techniques out there, like stecco, fascia manipulation, 80% overlap with acupuncture points. Okay. And a lot of things overlap. If somebody tells you that they invented something out of the blue, they're probably full of shit.
Yes, it's probably not what you want to do, right?
Yeah, because nobody's smart enough to just invent a new system, a new way of the body from complete scratch without it basing it on something else. I just don't believe.
No, for sure, and you see it all the time, right? Especially on social media, people coming up with all this random stuff, kind of like what you said, right? People are jamming lacrosse balls and in places it shouldn't be, right? To release and thinking it does some kind of magic, but
So to answer your question, this is totally something that anybody can try themselves. But if you have pain, it is always recommended that you get it evaluated by a healthcare provider.
Yeah. Okay. Cool. And then kind of closing this thing out, right? So you just started a new practice. So tell us a little bit about that.
So I work in the Valley in Los Angeles now, setting down some roots here. I kind of got tired of the international traveling stuff. Yeah. So I work at a practice called Sports and Spine Rehabilitation Center at prehab.com. Okay. And I'm just serving the area, local athletes. I work with some private schools in the area, some colleges in the area, and obviously the general public. So if anyone's in LA, hit me up. Yeah. If you want to follow me more on social media, it's just Dr. Justin Dean. You'll find me on Instagram. I have more of a running thing that I'm just starting, which is back to running. Okay. I'm trying to get more of a running niche market going. Yeah. That's where I talk the talk the most. In every sport, you have to talk the lingo of the sport. For sure. Yeah. So the one I know the most, that in powerlifting, most likely. Yeah. And
are you on Twitter at all?
No, man, I never got into Twitter. I never understood it.
Yeah, it's fair enough. But okay, so Dr. Justin Dean on Instagram, that's the best way to reach to you?
Yeah, totally.
Perfect.
Anybody can email me at any time at drjustindean@gmail.com as well.
Okay. Awesome. Well, thank you for your time, Dr. Dean. I'm going to have to listen to that again, maybe 2 or 3 times. There's a lot of stuff there that I need to unpack. So I really appreciate your time. It was great talking to you, and hopefully we can connect again soon.
Yeah, man, likewise, for sure.
Wow, a lot of good things in that talk, y'all. Dr. Dean's one of the smartest people I've had the pleasure of talking with, and he can really break things down into usable bits that you guys can apply to your practice in the coming weeks and months. I would encourage you to look up some of the topics and techniques that he discussed here earlier because it can really make a big difference on your understanding of how things work. Thank you to Dr. Dean. And as always, if you enjoyed the podcast, please like, comment, share, and give us a rating so we can make this thing easier to find on iTunes and help get this information out to the people that are trying to find it. Once again, thank you for listening. This is Juan Perez with the Gamut of Performance Podcast.